Welcome back to Learning Pathology with Dr. Bhavana. We now move on to the next video of the practical series, Hemoglobin Estimation. Hemoglobin estimation. The normal values of hemoglobin in adult males 13 to 18, adult females 12 to 16, children 12 to 14, infants 16 to 22. We have various methods of hemoglobin estimation. Acid hematin is the most commonly used in your practicals. Sign with hemoglobin method, which is actually the ideal method. Oxyhemoglobin, alkali hematin method, Haldane carboxy hemoglobin method, other methods like gasometric method, specific gravity method and Tallquist method. In the modern laboratories, we use autoanalyzers. We go on to the Sally's method, which is the most commonly used. The principle of Sally's method. The hemoglobin is converted by HCl into acid hematin. So, acid hematin formation is the principle of this method. This acid hematin gives a brown color to the solution. It is then matched with the comparator of the Sally's hemoglobinometer. The anticoagulant which is used is EDTA. Coming to the procedure, we have a graduated tube in the hemoglobinometer apparatus. N by 10 HCl is taken up to the 20 mark. We pipette blood of 20 cc into the hemoglobin pipette. Then we add the blood to the HCl. Then we have to wait for 10 minutes. This 10 minutes is for the formation of acid hematin. Then distilled water is added drop by drop till the color matches with the color of the comparator rods. The hemoglobin expressed in grams per deciliter. So this is the apparatus, the comparator, the center one is the hemoglobinometer tube and the last one is the hemoglobinometer pipette and the stirrer. As shown in the diagram, N by 10 HCl is taken up to the 20 mark. We pipette 20 cc of blood, add it, wait for 10 minutes. This is the chocolate brown colored compound called acid hematin. We place it in the comparator rod, we place it and then we add water till the comparator rod matches with the color. The main advantages of Sally's method, even though it is not ideal, it is a simple bedside test. The reagents and apparatus are very cost effective, easy to perform, quick and less expertise is required. Coming to the disadvantages which will be asked, time factor is the main thing. The color of the acid hematin fades quickly with the passage of time. Color of the comparator rods also fade with time. Acid hematin solution is not stable and visual errors also are present, as the way visual errors vary from person to person in matching of the color. Technical errors are also very important, improper mixing, errors in calibration and all the types of hemoglobin can't be estimated, not suitable for fetal hemoglobin. And the non-hemoglobin substances like protein and lipids also influence the color. The causes of reduced hemoglobin. Reduced hemoglobin is called as anemia. Causes: blood loss because of bleeding, internal hemorrhage or parasitic infestations, drugs, lead poisoning, dietary deficiency, malabsorption of nutrients and chronic diseases. Increased hemoglobin is called as polycythemia. High altitude leads to polycythemia, severe vomiting or diarrhea leading to hemoconcentration and polycythemia. So these are relative conditions. Infants, smoking, polycythemia vera, obstructive lung disease, congestive heart disease and splenic hypofunction. Few tumors also called polycythemia cause polycythemia like renal cell carcinoma, liver tumors, cerebellar hemangioblastoma. Thank you. Thus we complete the hemoglobin estimation in the practical series of Learning Pathology with Dr. Bhavana. Our next video will be blood grouping. Thank you.